Good afternoon, everybody. My name is Dr. Giselle Tadros. I am a pediatric physical therapist and an oral motor specialist, and I run the page Milk Matters PT, and I am so super excited to be here. While I take care of a little bit of housekeeping things, why don't you guys all go ahead and tell me where you're from, where you're listening in from. I see some familiar faces. Becca's here from San Diego and Jessica's from Arizona. Welcome. I'm so glad that you guys here. Mrs. Algrant from LA, Sarah from Ohio, Pennsylvania, Brooklyn, India. Oh wow, cool. Kim Rose is from Kentucky. This is such the beautiful thing about Instagram because we all connect together. Anyone from Jersey? Yvette, Delize. Oh, Delize, I'm from Canada. I grew up in Mississauga and went to Queen's University. Cool, I'm seeing lots of different places. Poland, wow, New Hampshire, San Francisco, Nevada, Boise, Birmingham, Alabama, California, Utah, the Bay Area, Oregon, Long Island, Fort Lauderdale, Jersey City, what? My original practice was in Jersey City before I moved, and now we're in a little town called Martinsville. Oh, Fancy Pants, another Jersey girl in Germany. Trying to multitask. So many of you are here from all over, and I'm so grateful for that. Today I want to talk about something that comes up all the time is babies that have tension. So I want to talk a little bit about why a baby would have some tension, and then more importantly, I want to show you things that you guys as parents can do about it, because there's so many things, and you guys know if you follow me over on Milk Matters, one of my big passions is empowering parents to really learn about their child and advocate for their baby and find what it is that they need to get them help. And one of those things is just teaching you guys what to do. And then if you find that it's overwhelming, or if you find that it may not be working and you need help, then we can go through the avenues of getting you guys the right help. I too, Jessica, am so grateful for you. So thank you guys for watching. I've got my little bitty demo baby here to help me out with some of the things that we are going to be talking about today. So first of all, I want to talk a little bit about why a baby has tension in the first place. So there's a couple of different reasons. There's a variety of different reasons why a baby may have tension, and go ahead and throw it in the comments if your baby had tension and why you think they had that, because I think that'll be very helpful for parents. A lot of times it's just the in utero position. So when I was in school, they used to teach us small mama, big baby. But basically it means that the baby was a little bit squished. So sometimes the baby can be stuck under your ribs, and that could be the reason why. It could be that maybe you had multiples, and so they were kind of in this weird position. Of course, tongue ties, that's right. Tongue ties are a big reason why babies can have tension. And the reason for that is something called fascia. Fascia is, that like translucent connective tissue that you see on top of like a piece of chicken. That's fascia, and what that kind of wraps around all the different muscles and whatever. And so the tongue is actually attached to the spine through fascia all the way down to the tips of the toes. And so when that fascia is tight, it basically pulls on so many different things. And so what you're going to see in your baby is a lot of tightness. Okay, and what that means, they may have shrugged shoulders, so their ears and shoulders are touching. It could just be on one side, or it could be both sides. You're going to find that they have a really hard time opening wide. They can't open big, so a lot of times the first thing that you guys might notice is that you can't get a nice deep latch because they're not opening wide enough. Sometimes they can open wide on one side, but the other side isn't opening very big, so it's an uneven opening. And I mean, I can't do it But one side opens wider than the other, and that's always a sign that there's some kind of tightness or stiffness or fascia. A lot of times we say a baby is supposed to go, down and through the birth canal and come out. That allows them to rotate their head and extend and really stretch as they come out. So babies who either go through too quickly, so a rapid delivery, and don't really get to extend those tissues and stretch, we find that sometimes they have some tension, or babies who get stuck, so babies who can't come through and end up pushing for a really long time. I find that those also have some kind of tension and tightness. Let's see what else you guys said. Very fast unintended home birth. Oh geez, that sounds like quite a story. Tongue tie, tongue tie and cheek restrictions. My baby won't relax her head backwards and gets frustrated when latching even though her ties are fixed. Jessica, you're in the right place, because that's exactly what happens, and that's why I actually have a job, and I've been able to open my Milk Matters clinic, which used to just be a informational page on Instagram, but now, because of all of you and the need to have a place where you could bring your babies to learn what to do with this tension and tightness, to help them figure out how to latch despite their tongue ties being released, we now have a clinic here in Martinsville, New Jersey, to treat all of these different babies. So just because the tongue was released, that fascia may still be tight, and that's sort of what we're seeing. Also, just because the tongue was released, the tongue doesn't automatically know what to do, because the baby has been sucking in this wrong pattern since they were in utero. And so our job as therapists is to release and relax some of that tension and tightness, but also teach the baby how to use their tongue the way it was intended, so they're not just chomp, chomp, chomping. Upper lip and posterior tongue tie squished in utero under the ribs. Very good. You must be a therapist. Yup. Good job, Al Hutchins. 8.5 pounds and always wanted to stand up. Lip and tongue tie breached until 37 weeks exactly. Sunny side up. C-section babies. Lip tie, tongue tie, sunny side up. Absolutely. Very good. Stuck for 3.5 hours in the birth canal. Absolutely. So that will cause a lot of tension and tightness because they're in the canal. Sometimes they're tight in utero, and so when they start to go through the canal, they get stuck that way because that shoulder is either up at their ear and they can't extend their head properly and rotate to be able to exit the canal. Baby was 9.8 pounds. I pushed for 3.5 hours and her shoulder got stuck, and she also had a lip tie. Absolutely. I find that I hear these stories over and over and over. Every woman that comes into my office seems to have some kind of a story around birth and delivery. So I really do believe that something during that birth process is linked to either the tongue tie. The tongue tie is why they're having trouble coming out because of those fascial restrictions, or that rapid birth. Feeding issues. Thank you so much for bringing that up. Hey Denise. Milestones in Motion knows that sometimes when a baby is having trouble eating, let's say they have a lip or tongue tie and their tongue is not elevating up and curling to be able to latch correctly, they end up getting really stiff and tight. Think of when you open a jar of pickles, you're really trying so hard, and like all these muscles are contracting as compensation to help you get that open because you're having trouble. Think of a lip and tongue tie as that tight jar that won't open. So the baby's recruiting all these different muscles when they're eating. So if you're noticing that their ears are up at their shoulders, their arms are here and in a fist, and after they're done eating, they're still not relaxed, there could be some tension there as well. All right. So let's talk a little bit about what that tension could look like. We did say they would have those like shrug shoulders. Okay, they would have a furrowed brow. Sometimes they're just so tense and tight. You see these like two lines here on them and you can't get them to relax. They get these deep, dark red creases inside of their neck. So babies who you have trouble getting in there to wash, or that you'll see that they're very pink or red when you do open up, that is always a sign of tension. Sometimes babies have a preference to look towards one side, so they may have difficulty looking the other way, and again, that could be a result of the tension and tightness. Sometimes they have what we call a C-curved body, and so what that C-curve looks like is like this. So their shoulder would be down closer towards their hip. So if you were to draw a line, you would see that from here to here, it actually forms a C. That might be a backwards C, I can't tell from the video perspective. And we talked about being unable to open wide and having an uneven mouth opening. So I want to switch gears a little bit now from how to identify a baby has tension to what can we do about it. So the really, really cool thing about babies is they respond so quickly and easily. So, you may have tension in your shoulders, in your spine from your poor posture or whatever, and it takes us a really long time to figure out how to adjust it and how to get the muscles to relax. Well, that's not the case for babies. I would say in like 4 to 6 weeks they learn and they adjust, and that's it. So you come to physical therapy or occupational therapy or whoever it is that's doing the body work to get rid of that tension, and then you usually don't have to worry about it again. So what are the different things that we can do? I want to talk to you guys about my top 3 things that help to get rid of some of the tension that you could do on your own at home. Number 1 is massage. Surprise! So I think you can do massage on your baby with your hands, and there are infant massage courses that are available. But one of the things that I love using is this Homedics massager, and I will put a link to this so that you guys can get one. It's literally under $10. There's 2 kinds. So this one has 4 little bumps, and when you turn it on, it just vibrates. Can you hear that? And this one, also made by Homedics, I find that these are gentle enough for a baby. Also, it lights up and it vibrates. Okay. And what you're going to do is run it up and down along their spine. So you're going to turn this on. You're going to put it up at their shoulders right about here. And you're just going to run it gently down all the way to where that diaper line is. And then back up. Of course, my baby is not a real baby. So you could position them either on you like this. And you're going to run it up and down. Okay, you could put them on the change table. You're going to find that your baby melts. They love this thing. It's hilarious. And so I love doing this to a baby when a parent is here and they're super fussy, and I have them in tummy time, and then I put this on, and you literally, it's exactly what you would do. They just kind of melt into it, and they're just the cutest. So again, this is available at Walgreens, Walmart, Amazon. Super inexpensive. It's not designed for babies, but it's what I use on the babies, and they love it. It is the Homedics massager, and I will put a link to this if you go and check out my page today, and I'll put a link up for this. S Denim is asking me if I have a preference. Is the only difference a size? So they're actually kind of the same thing. One is a little bit of a, a different model than the other, but they accomplish the same thing. This one I like because it only has 2. So as a PT, I can be a little bit more sort of particular about where I'm going and what I'm doing. But this one is totally fine. It was the first one that I ever found, and it's fine. Somebody, Heidi, asked me what age can we start this, and the answer is anytime. I've done this on children as young as 6 days old. As long as you're not anywhere near the front of the neck, okay, you're going to be on the back. then there's no age limit, basically. All right, so the reason I like this too is you don't want to be directly on the spine. So the fact that those bubbles are sort of perfectly spaced apart, you make sure that you're on the paraspinal muscles or on these muscles that are on either side of the spine. Okay, so we're using this to get rid of some tension in your baby, to relax some of those muscles, and you'll see them melt into it when you use this massager. Okay, I would be remiss if I don't tell you one of the best ways to get rid of tension is to get rid of containers. Do you guys know what I mean by containers? Can you list what containers I'm referring to down in the comments? So a container is basically anything with a seatbelt, okay? A bouncer, a rocker, a car seat, a stroller, anything that is going to restrict or contain your baby. I want a swing, absolutely. Anything that has a seatbelt. That's how I kind of want you to think about it. Okay, the jumper, absolutely. The Mamaroo, very good. You guys are reminding me. The Baby Bjorn bouncy seat, yes. All of these things are what I consider containers. Car seats. Okay, so I am not opposed to using them. If you are going in the car, you need to use a car seat. If you're going for a walk, you need to use the stroller, okay? The baby carriers, it depends which ones you're talking about. If you're talking about like a baby wearing like a Sully baby or a boba wrap, I actually don't mind those wraps. I think that the wrap still allows your baby the ability to move. They're able to look side to side, up and down, and get some weight through their arms. So if you're using a baby carrier in moderation, again, for its intended purpose, then I don't consider it a container. Okay, but what happens is when you put your baby in a swing, they're kind of just like this. They're staring off at the mobile or whatever it is, which isn't a bad thing in general, but what it does is it prevents them from allowing to move. Now, you guys all know that movement helps decrease stiffness. And so just think about when you wake up in the morning, you may have some stiffness or soreness in your back. But just by virtue of you getting up and washing your face, brushing your teeth, taking a shower, that little movement that you're doing helps to get rid of stiffness. That's basically the premise of physical therapy in a nutshell, that exercise and movement decreases stiffness. So those containers do the opposite, right? So sometimes the containers can be causing that stiffness and tightness, or at least not allowing it to naturally disappear. You guys know that your babies are born in what we call fetal flexion, so they're in this fetal position when they come out of the womb, and they need time to unwind and stretch. That happens naturally with gravity and allowing them to just be free. So don't be scared to take a blanket and lay it down on the bassinet or on the floor and just put your baby down. You're gonna see that they start turning their head, they start moving their arms, they're kicking their feet, and that is going to naturally get rid of some of that stiffness, okay? So containers are a huge topic that we could go on and on and on about, but what I want to say is this: if you're using it for its intended use, if your baby's in a car seat, it's okay to use the car seat. If you're going on a walk, it's okay. If you are putting them in the baby wrap, that's also fine for that purpose. But you want to try and limit it, and you want to also do a little bit more of my number 3 tip, which is tummy time. Okay, tummy time is such a great way to work the muscles. So not only is it stretching everything in the front, so all the things that we were saying can get really, really tight, you know, those neck creases and the shoulders up, all this front space here will naturally relax when you put your baby in tummy time. Now, I know, babies that have had tongue ties or have tension hate tummy time. So you don't have to do it on the floor. There's a whole lot of different ways that you can do it, and I have a free tummy time guide that you are welcome to check out over on Milk Matters PT that give you 10 different gentle ways to do tummy time for a baby that is not very good or does not like tummy time. My number 1 rule is that we don't allow babies to cry in tummy time. Tummy time is supposed to be a fun learning position, so we respond to our babies. If your baby is upset during tummy time, we take them out and we try it either a different way, an easier way, or a little bit later when maybe they won't be so fussy. But I do not want anybody to force their baby to be in tummy time, okay, when they are unhappy. I'm getting some really good questions here. Let me see. What about swaddling? Great question. Swaddling is another whole topic. In general, very general here, swaddling past 10 weeks is not really recommended for your baby. Swaddling past the time where a child can roll by themselves is straight up dangerous and should not be done. So if your baby is, 4, 5, 6 months, they should really be out of a swaddle. If your baby is 2, 3 months, you should be starting to think about how to transition them out of the swaddle. Again, this, for a baby who is healthy and not having any tension, not having any tongue-tie issues, I'm not as strict with my guidelines. But for babies that have tension and tightness, that swaddle can really be contributing to the problem. Thank you for asking that question. Velcro swaddle is not my favorite. So somebody said that the baby squirms and tenses up more when I use the Homedics massager. What are you doing wrong? So Irish Setter Maui, I don't actually know that I have enough information to answer your question, but perhaps it may be a good idea for you to find a local person, pediatric physical therapist, or somebody that can help you answer that question and really understand why your baby doesn't like it. Maybe they're ticklish, I don't know, but maybe it's causing other things and you need to have a trained eye look. It's not something I can answer without knowing more information. Noor is asking, when can we start tummy time, at what week? Thank you for asking this question. I love this question, and it's gonna kind of tie in with Clock 18's question of how much tummy time. So I like to start tummy time day 1, and I think that a lot of you are. You just don't realize that you are. How many times has your baby fallen asleep on your chest? Okay? If your baby is awake, if your baby is awake and pushing through their arms, okay, lifting their head, looking at you, hi baby, that's considered tummy time. So hang out here with your baby, okay? This is how you do tummy time in those first few weeks of life. The baby's opening up the muscles, stretching out, okay? So many good things are happening in this position. So we are starting tummy time week 1. If you haven't, that's okay. It's not too late. Start now, okay? And you're gonna do as much tummy time as your baby tolerates. Remember, we respect our babies. We listen to their opinions, okay? So if they're upset or unhappy, we're taking them out of tummy time. I can guarantee you, though, an infant in this position is gonna be pretty happy and satisfied, okay? So this is always how we start our tummy time. Chest to chest, pushing down through their hands. Elise Doppel says, how does that apply to preemies? I'm not actually sure which part you're talking about, but maybe if you clarify, I can help answer your question. How do we deal with torticollis when they prefer one side? Jennifer, thank you so much for asking that question. I think it's really important that you work with a pediatric therapist to really help address that issue. If your baby has a true torticollis, it is not going to resolve on its own. Your baby needs therapy, your baby needs exercise, your baby needs recommendations, as well as sort of watching out and monitoring the need for a helmet. So I would definitely work with somebody and don't try to do it on your own, because it can get super stressful. Danny says, I've tried chiropractic care and craniosacral therapy and haven't had much luck with releasing tension from my son. Are there any therapies in addition to the 3 things you've mentioned we should try? Danny, I have something on my page called the Finding Help Highlights. If you go there, you should be able to go through all the different databases and links that will help you find someone that's local to your area. If you are still having trouble, definitely send me a DM. I'm happy to try to help you locate somebody. But I don't know what the chiropractor or craniosacral therapist is doing, and I don't mean anything negative, but if you are finding that it is not helping and they're not able to show you a benefit, then find someone that can help you. Okay, there's so many knowledgeable people out there. You don't need to be continuing to do something that you don't feel is beneficial. Is there a website to find PTs and chiropractors? So again, I have a Finding Help Highlights on my page, which can help you find people that are local to you. I also find that there's some Facebook groups. If you ask around, you can't be the only one. Somebody is going to have a recommendation for you that is local. My baby rolled a few times around 3 months and has not rolled since. I do tummy time every day during every wake window, 6 months this week. Christina, I'm not really sure what your question is, but good for you for doing tummy time every day. Just keep at it. If you're concerned about rolling or any kind of developmental milestones, then definitely check in with your doctor or a pediatric physical therapist, and hopefully they can help you. If you're having trouble, send me a DM and I'll help you find somebody. Excuse me. MC Kayla, my daughter's buckle ties grew back. Any advice? Well, let me tell you something. You want them to grow back. You just don't want them to be so tight. So every child's ties grow back in the sense that you develop sort of, there still has to be something that's attaching. That's what a tie is. A tie is when it's too tight or too short or too thick. And so we release that, but they still need to have a tie. So I wouldn't assume that there's reattachment here, because the healing actually does sort of bridge the gap. What you need to look at is function, and you really need to work with somebody who is knowledgeable that can assess function and help you figure out what's going on there. Michaela, you asked about the arm up swaddle. It's not my favorite. Timing of swaddling and such, born at 31 weeks, currently hitting due date tomorrow. Elise, congratulations on your little miracle baby. I'm so happy to hear that you are hitting your due date. I think with preemies, it's really important that you work with someone who is knowledgeable, knows about preemies, knows about human development. Just a quick, you probably know this already, we age adjust for preemies. So if a baby was born at 31 weeks, we age adjust, meaning we don't consider your baby to be anything yet. Tomorrow on her due date, she will be day 0. And so we give your baby that grace to learn all the developmental milestones and such. And so for you in particular, if you've been advised to swaddle, then that is fine. What I normally tell parents is just look at the position. When you swaddle them, are they up here? So maybe that's not the best thing for them. Loosen that swaddle a little bit. Take one arm out. Look at that swaddle. Use your mommy instincts and apply that to your baby. Do I think that a tongue and lip tie procedure is necessary? So that is a really interesting question. And again, without knowing more specific information about you and your family and what kind of issues you are having, it's really hard to determine. I really take it in my clinic as a case-by-case basis. We talk about it with our families. We figure out what the functional issues are. Are you having trouble feeding? Are you having pain? Are you having recurrent mastitis? What's the issue here that needs help resolving? Did therapy help to resolve that issue? And if not, then maybe the tongue tie is the next step. But you really need to look at that with somebody who knows. So you definitely need to get a thorough evaluation by a trained provider so that you can best understand what's happening, why the baby has tension, and what we can do about it. What's your recommendation for transitioning from a swaddle? What can be used after? That's a really good question. I think I might do like a post on that. But as I was saying, why don't you start with just tying it a little bit looser, not velcroing them in so tight that they're sort of like this all night. So start by loosening that swaddle a little, and then let one arm out, Then let the second arm out, okay, and then you can transition to more of like a sleep sack. How to prevent flat spots of babies are supposed to sleep on back. Jennifer, that's a really good question. I always encourage lots of baby wearing, getting out of containers, okay? So the containers sometimes can cause the flat spots and don't help getting rid of them, okay? Having them just lay flat is always the best thing. If you are finding that the flat spot is very visible and you can see it and it's bothering you, definitely reach out to a therapist. We are very well trained on how to get rid of this, and the earlier we see you, the quicker it can resolve. So babies who are seen before 1 to 2 months old do way, way better than kids that are over 4 months. So don't wait until 4 months or 4.5 months or 6 months. Come to us early. There's a lot we could do to change that head shape. My baby has her tongue, rest, mouth open. Would this help for that? So Shelly, I'm not actually sure what this is, but definitely a little bit of tongue mobility and proper therapy, and oral motor therapy specifically, is going to help your baby. It's really, really, really important that your baby's tongue rests on the roof of their mouth, that it's not down here, that when they sleep, their mouth is sealed, their tongue is up, okay? If they don't, definitely oral motor therapy is important. How do you tell if your baby is tense? Why don't you go back and watch the start of the video, because we talked about a lot of things that cause your baby to be tense and who you should look for and all of those different things. Kim Rose, tips for toddlers. Tongue tie released at 12 months, 17 months now, still dealing with mouth breathing and drooling. CST says tightness. Well, I'm very happy that you're working with a CST already. Toddlers are not my area of specialty. I really stick to babies who are less than 6 months of age. But find someone, again, in your area that deals with toddlers. I think that a SLP or a speech and language pathologist or a feeding therapist that has their certificate in orofacial myofunctional or a COM is a really good place to start. Again, check my Find Help highlights. I have a list of all of these different databases to help you find somebody. Are you going to talk about what the video showed that told us about this talk, rubbing the front of the chest? Oh, good question. So I wasn't actually rubbing the front of the chest. I just kind of had my hands down here. So this is a very light maneuver that we were taught to help open up the neck. Okay, so just a gentle pull down on the clavicles or the shoulder right here. Okay, just pulling them down is all I was doing. Okay, and what that did would allow the tongue to move, allowed the neck to open up because of all the tension and stuff that can lay in here. So if you're feeling like your baby is here, you can definitely try this to pull down. It is a therapeutic maneuver, and so I don't generally teach it to parents, but if your baby is comfortable and you want to try it, you can definitely give it a try. How crazy is it that that video has like 5 million views? Shelby said 5 people missed my baby's tongue tie, and the dentist noticed how, now that he's 15 months, how can I prevent it for the next baby? I need to be able to breastfeed next time due to formula shortage. Shelby, I think you're already the better for it. The more you know, the more educated you are to be able to help your baby. What I recommend is just know what you're looking for and get the help that you need right away. Don't stress about it now, but now that you know better, you could do better. Can I suck train with Nini pacifier only? 4 months old, won't suck on a finger, never would really. 2 tongue tie released and both reattached, feeling so defeated in speech and Cairo 2 days a week. Oh man, I wish you lived close by to me. Suck training is a very complicated thing. It's really easy to try and make it super easy on the internet, but there's a lot of things that go into it. There is, your baby is 4 months old, so they probably don't have their suck reflex anymore, which babies are born with. And so I would definitely recommend working with your speech therapist to work on that oral motor therapy. And if they don't do oral motor, to find somebody that does. It's really important to get that tongue moving. That's sort of one of the things that we look for. And if you're having trouble finding somebody, definitely send me a DM. My baby hates swaddling but couldn't sleep well and gets distracted with her hands. Is it okay to force swaddle her arms down? So, what I'm going to say, cutie, is listen to your gut. If your baby hates swaddling, listen to your gut. Nurse the Plants. My MD recommended a pediatric dentist for tongue tie assessments. Should I have baby evaluated by a PT as well? I would definitely say yes. I find that the babies that do the best before and after a tongue tie release are the ones that get a little bit of pre-oral motor and pre-body work before the release. What we do is we just get the body in the best shape possible so that when the release is done, the brain kind of understands what it needs to do, the body is relaxed, and you're not fighting the tightness. So I think that not every PT can do this work. It's more important that you find an oral motor therapist that is trained in tongue ties. If you need help, send me a DM. Do I recommend tongue tie procedures? We answered that question already. My 7-year-old, I'm guessing that you're saying that they are chomping. That could definitely be a sign of tightness. The tongue is not functioning well. I definitely think you should look for an oral motor specialist. Anything to do to help with your baby's C curve? Does it go away on its own? So all the things that we talked about in this video today are super helpful for that C curve. If you find that you've been doing these things and they're either unhelpful or not fully resolving, I definitely recommend that you find help. So many babies come to us for this, and as therapists, we can give you the right information to release that tension. Do I have videos of what an ideal latch while breastfeeding should look like? Definitely check out Legendary Milk. They are a wealth of information. They pretty much have any and every video that's helpful for breastfeeding right here. They repurpose and reuse videos from all the great ones out there. So check it out right here. Baby likes to sleep on only one side at night. Should I be worried about a flat spot? What can I do? Great question. So if you're finding that your baby is always turned to one side to sleep, definitely during the day you should work on getting them to rotate to the other side. Okay, I recommend if you're going to change them this way and they're going to look at you, then the next time you change them, you're going to put them the other way so that they can look at you. And that way you're always sort of changing them around and allowing them to look other ways during the day. I find that if you target that neck range of motion during the day, then at night you'll finally see that they will sleep on the other side. My consultant told us to look for an osteopath. What's the difference between them and a PT? That's an awesome question, Rebecca. Thank you so much for asking. So, an osteopath is actually someone that uses their hands to move the bones and adjust the bones. A physical therapist also kind of does a little bit of that. It tends to be not as gentle, so sometimes when you're with an osteopath you may not really know what they're doing because their hands are so super gentle. One of the big differences that physical therapy does is we give you active exercises. So we will have you have the baby turn side to side and give you ideas of how to do it. We will have you have the baby reaching for things. So depending on their developmental level, we're going to give you active exercises to work the muscles in addition to moving the bones. So it's kind of like there's like several ways to get to a destination. So you could go this way, you could go straight, you can go the other way. All these things help, and I have found that it really just depends who you have in your local area. So my first thing that I always say is, who does your lactation consultant recommend? Ask them who their favorite and most effective is, and that's who you go to. Does craniosacral cause discomfort for babies? My Cairo says it doesn't, but my baby cries and looks like he's in pain. What a great question. I've always asked babies if they're in pain, and they've never answered me. Sorry. Anyways, we don't know. We can only assume that if your baby cries, that maybe they're not happy with whatever is happening. Sometimes they can be irritated. Sometimes they can be in discomfort. Sometimes it can be straight up pain. I don't know, just like you don't know. But trust your gut, okay? I always tell a parent, if you want me to stop, we stop. I stop when I think a baby is in discomfort or pain. If I think they're complaining, I ask the parent. It needs to be a relationship here, okay? So I am here to help you with your baby, not to fix your baby in any way. You are coming to me to learn, and so together we're going to help your baby. And that's, I think, the most important thing. If you're uncomfortable with your baby crying in someone else's arms, then take them away from them. Okay? You're a mama first. Your job is to protect your baby. Just because we are professionals doesn't mean that we know any better. If you want to take your baby, then you take your baby. I hope that helps. Pretty sure my baby doesn't have a tongue tie, but he often sleeps with his mouth or tip of the tongue sticking out. Would tension cause this? He's 3 weeks old. Marina, I suggest that you have a thorough assessment done by a trained provider. I think that's the only way to really answer this question. Colleen, my baby's very squirmy, crying and arching at the breast. Could this be tension? It absolutely can be. Again, you really need somebody who can provide you with a thorough assessment that is trained in tongue ties and tension and all those things to really be able to put the pieces of the puzzle together. Because sometimes there's so many factors that can go into it, and we need to know what it is that is happening. Victoria says, can a tongue tie affect tightness in the lower body, specifically the hips? Absolutely. Like I said, the tongue is actually attached to the spine through fascia and all the way down to the tip of the toes. So there could actually be tightness anywhere along that chain. You guys, there are so many questions here that I'm not going to be able to get to all of them. Thank you guys all so much for coming. We are going to do a giveaway of a portable breast pump. What? So stay tuned for that giveaway. Everybody that was here today is going to be automatically entered. And let's see. Thank you so much for coming. If you learned something new, put a heart or a thumbs up, and head over to Milk Matters PT to check out my page. I have so much information there of all these things that we had already talked about. Thank you so much, and see you later.